Rigicon malleable penile implant surgery in the first day back from one video only. So the main issues heart passage syndrome. A young patient, 22 vayasana age. So we surgery cheyidanu inna back from one video cheyidanu. So baby size penis ulla size aanu inna ningal kaana povunga. Idu baby size ulla size ulla penis cheyida surgery aanu inna ningal kaana povunga. Ippudu na ee age ulla normal ulla adult size aanu namakku kittu. So our result in the video.
It is normal for there to be some redness.
Yeah, usually there will be redness. For a little that in the stitches, little or bleeding was there. That's why it will get solved. It will get solved.
Okay. Is it because I moved to the right or something?
No.
But definitely the penile implant is a more painful surgery than they say.
You felt the pain?
No, not during.
Okay.
But it is a bit uncomfortable. It's a,
Yeah, we are placing a foreign material, right?
Into a very sensitive part of the body. Now, for this, will be a girth reduction or this will be just as it is?
There will be a girth. The girth will increase when you are having the sexual activity or when you masturbate.
And something such as, like a fat injection to get back to what it was, that's a very painful thing like this, just a one and done syringe?
It will be done in the syringe. It's not painful.
And it's a one-time thing or you have to come back over and over?
Usually it lasts for around 18 months.
Okay.
18 months.
And now it can be bed from today?
Today no need. Might be tomorrow or tomorrow I will ask you that.
Okay.
Tomorrow today because there was a little bleeding now, so today no need. Keep your legs straight.
Good, I'm not infected.
No way you will get infected. Don't worry. Just in the skin there was a little or a bleeding. That's why we are cleaning that area.
Okay.
So that it will be clean and I put the waterproof dressing.
What was the bleeding?
Usually there will be might be certain people if there is any minor capillaries near the skin, it will little bleed. Usually the first day. That's all.
And you have some people prone to it, right?
No, you are not prone to it because during the surgery I saw you are not prone to it.
Not prone.
It's just a capillary.
Okay. Was there any blood visibility?
Yeah, there was. Might be would have lost around 15 to 20 ml of blood.
Not much, right?
Inside the corpora that much only. Yeah. Nothing much. We will share you.
That means there was some blood in the corpora, like there was it natural little bit.
Yeah, it is there. That is there. So I dilated the corpora and everywhere I had washed it with the antibiotic.
Okay.
Then I placed the implant. Okay. So why I told I use 10 sizes? Because of this gland size.
It's thinner than the shaft.
Yeah, it's thinner than the shaft. That's the thing. If I place a bigger size, the implant will come on the side.
But that didn't impact the length at all.
So totally we had used 20.5.
Yeah.
So if you little reduce your weight, again you will get the length.
Okay.
Little reduce this area.
Okay. And I've taken up the.
Yeah. So your length will be better. So exactly what we measured was from this functional length, it's around 14 centimeter.
Okay.
The total length is 20.5.
Yeah. That was the trimix injection length, right?
Yeah.
Yeah.
So usually they mix in the trimix or even sildenafil, we measure the whole corporal length.
Yeah, that was 20.
20.5. 20 centimeter of the implant and 0.5 of the external.
Okay.
So 20.5.
So if I lose the weight, I can use the whole 20.
Anyway, this much area, it will be less. Because
and when I get the glance engorgement?
Yeah, you will get the glance.
Okay, so total around 20 I will get back.
Yeah, you will get it. So it's nothing to worry about.
And how much is inside of the body?
So here it's 14 means around 6.5 is inside.
Okay.
6.5 is
and if I press down, how much will I get back?
If you press this, how much you press down, that much you will get.
All the way?
All the way. How much you press down, because it's just here in this bone.
Okay.
That pubic.
That's the 6.5.
Right. So that whole area will get. And I felt during the surgery your suprapubic fat is little more.
Okay.
So if you reduce it, very good length you will get it.
Yeah, I'll get to around that way.
You will get it. because that fat it reduces the length.
Okay.
So and it is little difficult to reduce that fat. I prefer to do like some exercise. Might be in 6 months to 8 months you get that.
Okay.
Now we have reduced around 10 kgs earlier.
Yeah.
Another 10 to 15 kgs, it will do that. So now you are not feeling that hardness, anything, right?
No.
You are feeling that you had a hard plus.
Yeah.
So immediately, just so what I do is today I'll put just one compression bandage over there.
Okay.
And tomorrow I will do the waterproof dressing for you.
Okay.
So the waterproof dressing, maybe tomorrow only your pant will leave, right?
Yeah.
So that will be better. So that the bleeding will completely stop.
What kind of ED do you think you had? Vascular or this arterial
Uh, During the surgery, we cannot find out like what type.
or what do you think?
Might be arteriogenic. You don't have vasculogenic ED.
What does vascular mean?
Vascular means there is a venous leak or something.
Arterial is?
Arterial is the blood flow which is coming inside your penis.
Due to weight.
Might be due to weight. Obesity is one of the main reasons.
But I had this problem when I was younger.
But you had a good sexual life before.
With Viagra.
With Viagra.
So maybe since childhood I could have had some problem.
Might be. Your blood flow to the penis would have been reduced from the childhood. That is like we had done for very young patients like 23.
You had another patient who heart placid was also 18 centimeter after pushing down.
Yeah.
So it's the exact same thing.
No, I think I used not room break, might be around 20 to 21 something like that.
Okay, same as me.
Same as you.
Hi, I'm Dr. Joe Kaushik, andrologist practicing at Cleveland Hospital, Malayalam. So today we have an interesting friend. He became a friend of us. So he has traveled from so far and come here for the penile implant surgery. So we had done the Rigicon malleable penile implant for him. And the main issue was for him was hard flaccid syndrome. I had showed you on the table that after the spinal anesthesia, how the hard flaccid got released. So we had achieved a good length for him, and we had used a total implant size of 20.5 centimeter, which is 20 centimeter of the implant with 0.5 centimeter of the extender. Bilaterally, we have used the same size, and we are happy to accommodate him, and we are happy to give a good result for him. So let us ask him how he came here, how was his experience here, and how much satisfied with his result he is, and we'll ask him from him.
So with the highly respected Dr. Kaushik, I had searched through far and wide. I had seen urologists. I will start from the beginning of my journey. I started with the urologist in Singapore, named Dr. Tan. They didn't understand anything about hard flaccid. By the way, there's many Dr. Tans. This won't identify. There's probably millions. But I went to his center. He didn't know what hard flaccid is. He had assumed that somehow my penis had just shrank. And he began to try to sell me a course on using HA. He said, there's no way we can get your length back. There's no way we can achieve an erection. You can try Cialis, you can try Viagra. And I said, look, none of this is working. And as such, what happened was he became he slowly started to become less and less helpful. But eventually, I did read through his website, which had the final frontier of treatment. Penile implant. So I'd love to do research. I googled, is this really the final frontier? Not really. The American Urology Association now recommends it as a first-line treatment because it's better to do pills than to do needles and risk losing your size due to fibrous tissue. And I'm sorry, I'm not a medical professional, but that's my understanding. After that, I had gone and met with several of the absolute topmost noted andrologists, and I will not throw any belief upon them. I'm sure they're capable, but there was nobody as warm as Dr. Kaushik. So during this whole time, I joined a malleable support group chat. Of the website is totally random. I just searched implant, and then it said type of implant, inflatable, malleable. I thought inflatable. I don't want too many moving parts. I'm a young man. I just want to have a fun time and enjoy with my partner. And then I came upon malleables, and then I met a person whose name was Manfred. He's from Germany, and everybody knows that Germans are all about efficiency and transparency. And he has suggested Dr. Kaushik, saying that he's a very warm and loving man, and you will get exactly what you need from him. He will not short you a centimeter. In fact, he may give you a centimeter. And when I woke up on the operating table from Dr. Kaushik, I realized that I'd always believed him, but I really believed Manfred at that time, and I have absolute 100% faith in Dr. Kaushik and his nurses too. I speak English. I don't unfortunately speak Tamil. My Hindi is poor. I had a lot of problems. I thought I would have a lot of problems communicating, but whether through sign language or Google Translate, they worked so hard to get the job done. And Sweta ma'am was actually fluent in English as well. So overall, I have, in regards to complaints, my complaint is -1 because I actually have one compliment to give.
Thank you. So thank you. So it was really a happy journey, and we are also really happy to have such a happy patient, happy person, and he has become a friend to us. Thank you. Thanks a lot.
Thank you so much.